The rib cage is a crucial structure in the human body, composed of bones that work together to protect vital organs and facilitate breathing. The sternum, commonly known as the breastbone, and the ribs are the primary components of this structure. The rib cage serves three main functions: protection, support, and respiration. It acts as a shield for the heart, lungs, and other organs within the thoracic cavity, safeguarding them from injury. Additionally, the rib cage provides structural support, anchoring muscles of the chest, back, and upper abdomen, and supporting the upper body. Perhaps most importantly, the rib cage plays a vital role in breathing. It expands and contracts during inhalation and exhalation, allowing the lungs to fill with air and release it. The sternum, located in the center of the chest, is a flat bone that is divided into three parts: the manubrium, the body, and the xiphoid process. The manubrium is the uppermost section of the sternum. At its top, there is a noticeable depression called the jugular notch. On either side of this notch are the clavicular notches, which are the points where the clavicles, or collarbones, connect with the sternum. Just below the manubrium, at the junction where it meets the body of the sternum, is the sternal angle, angle of Louis. This angle is an important anatomical landmark, as it helps locate the second rib and is often used by clinicians as a reference point. The body of the sternum is the central and longest part of the bone. It serves as the attachment point for the true ribs, which are the first 7 pairs of ribs. These ribs connect to the sternum via costal cartilages, which are extensions of the ribs made of cartilage. Running across the body of the sternum are faint transverse ridges, which are the remnants of the separate segments of the sternum that fuse together during development. The xiphoid process is the small cartilaginous extension at the lower end of the sternum. It is the most variable part of the sternum, differing in shape and size from person to person. Although small, it serves as an important attachment point for muscles and has a clinical significance in procedures like CPR. The ribs are long, curved bones that form the protective cage around the thoracic organs. They are categorized into typical and atypical ribs based on their features. Typical ribs, ribs 3 to 9, have several distinct features. The head of the rib is the rounded end that connects to the vertebral column at the back. Just beyond the head is the neck, a slightly narrowed portion, and the tubercle, a small bump that also connects to the spine. The angle of the rib is the point where it curves sharply, and the body, or shaft, is the long, curved portion of the rib. Along the bottom edge of the body is the costal groove, which houses and protects the intercostal blood vessels and nerves. Atypical ribs include the first, second, and last 3 pairs of ribs. The first rib is shorter and broader than the others, and has a single facet on its head, which articulates with the first thoracic vertebra. The second rib is thinner and longer, with a more pronounced angle. Ribs 10 to 12 differ from the others because they have only one facet on their heads, and ribs 11 and 12 do not attach to the sternum at all, making them floating ribs. The rib cage is not a rigid structure. It moves to facilitate breathing. 2 key movements describe how the ribs move during respiration: the pump handle and bucket handle movements.